A very good morning, and I welcome back for the today's discussion, that is Pre-Cliical Prosthodontics Introduction by Dr. Srinivas from Department of Prosthodontics. The previous session about the Pre-Cliical Prosthodontics Introduction, we already discussed about the definitions of prosthodontics, different models like definitive models or the preliminary models or the diagnostic models, and different definitions of dental processes or maxillofacial processes, and various clinical situations we come across, like partial edentulation or complete edentulation, or the defects in maxillomandibular regions. The continuation of the previous session, today we're going to have a discussion about the denture basis definitions, then about the articulations and articulation procedures, and jaw relations. Most of the situations we need to have a live model in our hand for the purpose of diagnosis or the treatment plan, or making a specialty or the fabrication of the processes. To gain the live model, we need to perform one clinical procedure that is called impression procedure. For that, we need to understand the meaning of impression. Impression in general is defined as the negative likeness or copy in reverse of the surfaces of an object. When it comes to the dental impression, it is an imprint of teeth and adjacent structures for use in dentistry. To perform this impression, we need to know about the impression trays as well as impression material. Impression trays are the device which carries the impression material into the patient's oral cavity for the purpose of recording the tissue details, still when it is in plastic form. Impression can be a preliminary impression or the final impression based on the purpose of the need of a clinical situation or the laboratory situations. The preliminary impression is defined as a negative likeness made for the purpose of diagnosis, treatment planning, or the fabrication of custom or a special tray. For edentulous situations, most of the conditions, the preliminary impressions are made with impression compound material by using edentulous impression tray. Whereas the same edentulous situations, the clinical scenario is something different, not as a regular condition, then we need to switch on to another material like mucostatic impression material like alginate. Whereas for the partially edentulous or the completely edentulous situations, for purpose of making the final processes, we need to perform final impression that is defined as the negative likeness made for the purpose of fabrication of a processes. So most of the final impression technique need to use either zinc oxide usinol impression paste or metallic paste for the edentulous situation, or the rubber based impression materials for partially edentulous or completely edentulous situation. Once we finish the impression procedures and prepare the models, some clinical situations need a denture basis which exactly sits on the tissue surface of the model or the tissue surface of the model for supporting the occlusal rims to perform the jaw relations, or for making the bite installation with a different material. So denture base is defined as a part of denture that rests on the foundation tissues or tissue surface to which teeth are attached. The denture bases could be a permanent denture base or definitive denture base or the temporary denture base. The temporary denture bases are made with autopolymerizing resins, whereas the permanent denture base or definitive denture bases are made with the heat cure polymerized resins or the cast base, that is chromium cobalt cast base. The definitive denture base is defined as the polymerized removable base that will be incorporated into the definitive processes. It covers the oral mucosa of the maxilla and mandible. It can be used to record jaw relations and allow tray-in for the artificial teeth, which will be attached by means of a second processing, is defined as a definitive denture basis. Whereas the temporary denture basis, which is used for the purpose of making jaw relations or for the time being, which has to be replaced later with a definitive denture base, that is temporary denture base is defined as an interim or temporary denture base used to support and record the rim material or occlusal rim material for the purpose of recording maxillomandibular relations. Once the master model is obtained, either temporary or the permanent denture base is fabricated, the occlusal rims or the record rims are fabricated in the laboratory for the purpose of making a maxillomandibular relation, which is exactly defined as an occluding surfaces fabricated on interim or final denture base for the purpose of making maxillomandibular relations or the jaw relations and arrangement of teeth. This is very important laboratory aspect followed by the clinical procedure called jaw relations. Then what is jaw relations or the maxillomandibular relations? It is defined as a registration of any positional relationship of mandible relative to the maxilla. These records may be made at any vertical, horizontal or lateral orientation situations or the positions, which is also called as jaw relation record. Once the jaw relation is performed in the clinic, the seed occlusal rims will be transferred into the laboratory for the purpose of mounting or for the articulation. It is defined as the laboratory procedure of attaching a cast or the model to an articulator or cast relator. And this also can be defined as the relationship of dental cast to each other to the instrument to which they are attached. The mounting or the articulation is performed by using an instrument called articulator. Articulator is defined as a mechanical instrument that represents the temporomandibular joints and jaws to which maxillary and mandibular models may be attached to simulate some or all mandibular movements. The articulator plays a major role in the laboratory procedure, which acts as a patient in the absence of the patient. Whatever jaw relation we recorded in the clinical procedure will need to be maintained in the laboratory by means of mounting the models in the with the occlusal rims in the articulator. Now once the articulation is done and models are sealed in the articulator with a gypsum product or the plaster, then teeth setting will be performed. The teeth setting or the articulation is defined as the static and dynamic contact relationship between the occlusal surfaces of the teeth during function. So in this slide we discussed about the mounting procedure, then the instrument which is used for purpose of holding the maxillary and mandibular models in exact position which we have recorded in the clinic, that is articulator, and the definition of teeth setting or the articulation. With this session we discussed about the various terminologies, definitions or the nomenclatures and meaning of each definition of preclinical prosthodontics especially. So based on this particular topic, in detail description about the various laboratory procedures will happen in upcoming theory classes or the discussion. Hence, I suggest you to be familiar with this terminology and read about the exact meaning and definitions of each procedures we perform in preclinical work. As I suggested earlier, all of you need to download the glossary of prosthodontic terms and make a note of uh, each and every definition in that file. Thank you very much for your patience listening. Have a good day.